Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. We're joined tonight by Assistant Director of Metro Health, Dr. Anita Kurian, and this is our COVID-19 update for the San Antonio community. Halloween is coming up, and we want to remind you, don't be scared, be prepared. As a reminder, Metro Health has provided some guidance to celebrate safely. If you have children who would like to trick or treat, here's some tips to make your outing safer, knowing that we are still in the midst of COVID-19. Most important rule, number 1, stay home if you are sick. 2, wear appropriate face coverings. Costume masks are not adequate protection. Number 3, limit the size of your trick-or-treating group to those within your household. Also, bring hand sanitizer and use it frequently. Avoid going into homes and stick to prepackaged treats and avoid shared foods. Lastly, wash your hands with soap and water for 20 seconds when you return home. That's good for COVID, that's good for flu, and everything else that's moving around this respiratory season. If you're handing out treats this year, here are the 3 things to keep in mind. Safer ways to hand out treats include don't hand out candy if you or someone in your household is sick. Number 2, participate in distance trick-or-treating by not requiring trick-or-treaters to come to your door. And when preparing goodie bags, be sure to wash your hands with soap and water for 20 seconds before and after. Again, thanks to Metro Health for these guidelines for celebrating Halloween safely. You can get more at covid19.sanantonio.gov/Halloween. Now on to our case count for today. We're reporting 155 new cases of COVID-19 in the last 24 hours. Our 7-day moving average has also gone down to 223. Sadly, there are still people dying from COVID-19 in our community, and we are reporting 2 new deaths this evening. Please keep them and their loved ones in your prayers this evening. We have lost far too many of our neighbors and loved ones to this virus. Over in our hospitals, the numbers are continuing to trend well. There are 279 patients in area hospitals. In the last 24 hours, there are 25 new admissions. 109 people are in the ICU and 53 on ventilators with COVID-19. Again, please note, 84% of patients in the area hospitals are unvaccinated. This remains a pandemic of the unvaccinated. 16 patients are on children. Let me just quickly go over the progress and warning indicators before I hand it over to the judge. Some more improvements in our fight against COVID-19 are being reported on our positivity rate, which has dropped to 1.9%. Cases are on a downward trajectory, and we are seeing continued gradual improvements again in our hospitals. So with that, we have steady improvements. Keep up the great work. Thank you for helping us get a grip on this, especially as we move into the holiday season. And we know that COVID-19 loves company, so please keep those protocols in mind. Judge Wolf.
Well, everything is headed in the right direction. It's hard to believe that it's been 2 years now since we've gone through this COVID epidemic. And if you saw the summer rise and surge in 2020, the winter surge 2021, and now the Delta one that we're now trailing toward the end. The difference between the first 2 surges and where the third one we have is just that we didn't have the vaccines ready for the others. Now we do, and we should this should have never happened. And we will continue to get people sick. We will continue to have cases as long as people out there refuse to get vaccinated. It's been a crisis of the unvaccinated, and it concerns me while we're in really the right place that people out there still not getting vaccinated and still spreading it. We did see the FDA panel today authorize vaccines for 5 to 11-year-olds, and I assume that will be coming out. Anita will be able to tell you a little bit more about that. But we're heading in the right direction. But if you got a friend out there, you got a relative, I've heard too many stories where wives have tried to convince husbands to get it, and they don't get it, and they end up getting COVID, and they end up dying. Too many stories like that. So do everything you can to convince your friends and relatives to get the vaccine.
Thank you, Judge. And you can do that. If you haven't already, please get your vaccine and complete your vaccine series. If you know someone who hasn't been vaccinated, you can remind them that they can get vaccinated at a Metro Health clinic and you also would be eligible for a $100 HEB gift card. You can visit covid19.sanantonio.gov for a list of Metro Health vaccine locations. And to finding a testing site or a vaccine clinic, you can visit covid19.sanantonio.gov or call the COVID-19 hotline 311, hit option 8. And again, before we turn it over to questions, I do want to remind San Antonio families that the deadline to enroll in the federal child tax credit program, which could provide total payments up to $3,600 or $3,000 per child based on their age, is November 15th. That's coming up in a couple of weeks. If you haven't filed taxes in the last couple of years or didn't receive a stimulus check, please review your eligibility and enroll at getctc.org/San Antonio. Again, that's getctc.org/San Antonio. These payments do not count as additional benefits or income, so make sure your family gets the assistance you need. Again, please continue to do your part, mind the protocols, mask up, and get vaccinated. Do it for yourself, do it for your family, and do it for San Antonio. With that, the judge, myself, and Dr. Kurian are available for questions.
Dr. Kurian, what does research show is the best booster to get?
There are several research studies that have been done to find exactly what you're asking, but we don't really know what translates, how well it'll translate in the real life setting. So my recommendation at this time is get the booster that is available to you when you go to get a booster.
Are there enough needles and other supplies in stock for children to get their COVID-19 shot?
Yes, the pediatric vaccines are different formulations, and they will be coming to us from the CDC with their own ancillary supplies. So to answer your question, yes, there is no shortages to syringes and syringes and needles, and they will be coming with all the supplies we need.
How will administrators of the shot avoid confusion between delivering an adult-sized dose versus a child-sized dose of the COVID vaccine?
The key is planning. I am planning every day with the staff that will be administering these vaccines at our pop-ups as well as the Alamo Dome. We intend to have a dedicated team just to handle the pediatric formulations, separate from the adult vaccines. At the Alamo Dome, we are currently in the process of planning a different flow of patients, exactly for the reasons to keep the pediatric populations separate from the adult, to avoid and minimize any medical errors that potentially could happen.
And for the mayor and the judge, could you give us your reaction to the FDA panel recommendations for COVID shots, the Pfizer vaccine being given to children 5 to 11?
Well, I think it's a game changer. I've always thought that the ability to vaccinate school-age children who are required now to go back into school with schools being in session would be a critical point in fighting the pandemic. Currently, I think we have to continue to remind folks there are a lot of people who just can't get the vaccine, mainly kids under 12 years old, and those who have, are receiving certain treatments, immunocompromised, that are not able to get the vaccine. If you're able to get the vaccine, you have an advantage over this virus, and you should go do that. But when more people are able to and are eligible to get the vaccine, I think that changes the game positively in our favor quite a bit.
You know, I think it's going to be a big step forward, because when you look at the Texas school children, and Mayor and I have been doing everything we can to protect them, and it showed that where districts were using the masks that protected them not only from COVID, but also from RSV and also from the flu. But those that didn't, statewide, I think we're at a number of something like 200,000 children got COVID in school, students in school. And there's probably a lot more than that. That's the ones that have been documented. And then you saw some of the numbers. I believe some 14% were children. Now, I know there's a difference between a 12-year-old child and 11-year-old child, and the difference in the age requirement. But many elementary school children have had it. So I think it's going to be a big help, and will protect a lot of these children that have contacted COVID, and some of them with some serious illnesses.
Mayor, this afternoon there was a protest outside of the Jewish Community Center. It was a white supremacist meeting, gathering, and it had some pretty graphic photos of children on posters and was trying to intimidate passers-by. Just wondering, I know you've given a statement on this, but I was just wondering, was there any point at which a protest like that or a group gathering like that becomes something that you can do something about, move people off the street as it is a public sidewalk?
Well, I haven't visited with the city attorney or the police chief about that. I'll just say again first, it's heinous. It shouldn't be tolerated, and I hope that the community of San Antonio rises up again to stamp that kind of behavior out. It's a level of ignorance that is concerning and needs to be taken seriously.
Social media just amazes me, some of the things that people say they believe, and they've got it mostly over social media. It's just such a tragic outcome of this whole pandemic that people would go to those extremes with these crazy theories and their crazy lies that they hear and then they believe it's true. And it's just, something I've never really seen that widespread in society since I've been in politics.
And then, Judge, this morning, y'all voted to accept a $4 million settlement with Johnson & Johnson in their opioid litigation. Last year, you had criticized a similar settlement that the AG, Paxton, had settled for $7 million. I was just wondering what changed between now and then.
Actually, we're going to get $12 million. We're getting $4 million direct, and then we're getting $8 million, a little over $8 million in Region 6. So it's around $12 million rather than $4. And this is just one of the defendants. The other good part about it, before there was an agreement to pay 35% of that to attorneys representing the county. That's been reduced down to 9% for attorney fees. So it's a much better settlement, and I think that the Attorney General's office has worked with us and the Watts Law Firm to solve some of those issues. And this is just the tip of the iceberg. This is only one firm out of numerous ones that were manufacturing opioids, that were distributing opioids, that were retailing the opioids. So this is just the beginning of the funds that will come to San Antonio. And the Commissioner's Court's made a promise to all the citizens that we will use those funds strictly for treatment, for drug treatment. And so when we do get it, we hope to get some by the end of the year. This is not an 18-year payment. It's cash coming in before the end of the year.
And then just a quick follow-up, when y'all filed the lawsuit, lawyers talked about this being a $1 billion case. You yourself have said that it cost the county, the region, hundreds of millions of dollars taking care of folks that have been addicted to opioids. Do you think that the county will be able to recoup?
When that $1 billion figure, you got to understand, numbers pretty good. That was paid out over 18 years. A present value of $1 billion is about 500 and some odd million. This is the start of it. I don't know that we'll end up getting what we were hoped we would get, but I think we will end up in the long term, getting a heck of a lot more money as these other settlements come along.
Thank you.
That's all we have tonight. Thank you.
Okay.